So our first speaker this morning is Dr. Michelle Condo of the USDA Forest Service. Dr. Condo is a scientist at the Philadelphia Field Station. She completed her doctoral training in urban design and planning at the University of Wisconsin and her postdoctoral training in environmental health and epidemiology at the University of Pennsylvania. Dr. Kondo's research focuses on determining the health consequences of environmental disparities, the impacts of place-based and nature-based initiatives on preventing and reducing violence, injuries, and disease, and in the influence of community participation in place-based initiatives on health outcomes. Welcome, Dr. Kondo.
Thank you very much. I'm so glad to be here, and I'm going to just share my screen and get my slides going. Thank you. So, um, oh, are you able to see the slides, or are these my presenter notes?
That's the slides.
Okay, great. So I'm a U.S. Forest Service scientist. My research focuses on relationships between the health of our environment and the health of people, mostly as it relates to urban populations, but not solely. I think that not many people are aware that the Forest Service operates in urban areas. And it's true, while our primary mission is to manage the national forests, which there are 190 million acres of national forests. You can see them here in green. There are nearly 170 million acres of trees and forests in urban areas. And the Forest Service is committed to sustaining and protecting the health of all of our nation's forests to meet the needs of current and future generations. And I'm pleased to be part of that work. Having trouble advancing slides. There we go. Okay, so I wanted to show you. So I am stationed in Philadelphia, and we are one of a number of urban field stations. Okay, so I'm here to talk with you today about the role of nature, parks, and green space in sustaining human health, especially during stressful times. And to start off, I'm not going to do a super deep dive into the evidence here about the benefits of nature for human health, but I do want to give in a little bit of an overview. So there is quite good evidence now of a positive association between nature exposure and stress, anxiety, as well as mental health, including improved cognitive performance and ability to really focus and pay attention. I think many of us are finding that, especially these days, as well as improved mood and emotion. There's also evidence that more nature exposure, or at least the greener our residential environments, can improve our life expectancy even. And I'm going to share some of the details of research that I've conducted in these areas. And there are a whole host of other benefits that we are beginning to build evidence for as it pertains to children in particular. I want to start first to talk about stress and mental health as it relates to nature exposure. There's really good, strong evidence of the benefits there. But one of my critiques of this, much of this nature mental health research is that it rarely pertains to underserved populations and communities. And so I ask and try to ask in my research as much as possible, how can urban nature help reduce inequalities in health and in mental health? So my colleagues and I are working to fill this gap. To give you a few examples, so this is a study published back in 2015. My colleagues and I asked residents in two different neighborhoods to take a walk around the block close to where they lived. And we asked them to walk twice before and after an intervention occurred on some vacant lots. And you could see a photo, an example of what that might look like here. We asked them to wear heart rate monitors as well as GPS units. And we estimated, when they were in view of these clean and green lots versus when they were in view of other things or vacant lots that had not been cleaned and greened. And we found on average a significant decrease in heart rate, which we took as a marker of acute stress when walking in view of the newly greened vacant lots. We have also, some other evidence here around this type of intervention. We have recently, I guess a couple of years ago, published a study of, it was a randomized controlled trial, randomized controlled trial of this vacant lot cleaning and greening intervention, but on a much larger scale. So instead of 2 sites, we had nearly 600, and we randomly assigned the vacant lots to either a control or a treatment group. And I have some photos here of some examples what that looks like. It's a very standard treatment and involves clearing a lot of, and then planting some grass, some trees, and a picket fence that's permeable so people can walk through it. But we conducted a survey of residents living near all of these lots or these types, so the control and the treatment, both before and after the intervention, about 450 surveys. And we asked them about mental health, about their perceptions of their neighborhood, and some of their health behaviors and activities. And we found a significant improvement, decrease in feelings of depression, and as well as worthlessness. To go along with that, we found a significant increase in people reporting that they use outdoors to socialize with friends and family, and a significant decrease in fear of crime. So, and these could be mechanisms to these improvements in mental health. So reduce stress, improve mental health, as well as other benefits that trees and parks provide us, like more cohesion or less isolation, reduced heat island effect, and more physical activity could be mechanisms behind improved life expectancy for those with more exposure to green space, while controlling for socioeconomic status and other health behaviors that might influence these findings. And I wanted to share one study that we published this year. My colleagues, and here is the headline. So my colleague, David Rojas, he and his colleagues developed a dose response estimate of the relationship between greenness of people's residential environments and mortality or premature mortality. And this dose response estimate is based on a meta-analysis of 9 different studies that involved over 8 million people from 7 different countries. So the greenness surrounding participants' homes was measured with remote sensing, so satellite images, using the NDVI metric. And I suspect some of you are familiar with that metric, but I'm happy to explain it later if you'd like. But like the dose response relationships that we now have for air pollution exposure and mortality, they found that for every increase of 0.1 units of NDVI, so basically it's an increment of increased greenness, and which translates to tree canopy, near participants' homes, there was a 4% lower risk of premature death, for example, due to chronic disease. We then applied this dose response function to our potential, future scenarios. One of them, based on the Philadelphia's 2025 tree canopy cover goal of 30% across all neighborhoods in the city. We also, because I had some forest ecologists and urban foresters on my team, luckily, Laura Roman and Dexter Locke, we set we called that the ambitious goal, and we set a few other, scenarios that were a little bit less ambitious, so a 5% and a 10% increase in tree canopy cover. And so what we found, so we estimated that about 400 premature deaths per year could be avoided if the 30% tree canopy cover goal was met, with most of benefits seen in lower socioeconomic status neighborhoods. Mostly due to the fact that these neighborhoods have less tree canopy cover. So nature's benefits have been really magnified in the context of the coronavirus and quarantine conditions. And this is, part of why we're here today. And this is really the emphasis of my talk. So we face so many stressors right now under lockdown or quarantine measures associated with hold on our work, on our education, on our employment, school and childcare, and other basic life necessities, not to mention fear of infection, frustration, boredom, stigma. And this all can really cause negative psychological effects, including post-traumatic stress symptoms, confusion, anger. And nature plays a really fundamental role in our coping and perhaps recovery from all of these challenges. In some ways, parks and green space, they represent safe spaces for us because we know that, at least with social distancing practice, there are places where risk of COVID-19 transmission is lower, where we can be in proximity to friends and family, in person anyway, and where we can get our exercise and restore our minds. I want to share some results. This is a pretty impressive study recently posted to Social Archive based on over 6,000 survey responses from 77 different countries. The authors found that lockdown measures significantly affected mental health, while nature contact helped people cope with these impacts. Nature helped participants cope with lockdown measures, especially where the measures were most severe, as we might expect. And emotions were more positive among individuals with accessible outdoor spaces and green or blue, that's blue symbolizing water, elements in their views. And I've highlighted this here because I want to come back to it in a bit. But with social distancing rules, there are real limitations to partaking in these activities with others, right? And parks managers face a dilemma over their responsibilities to prevent COVID-19 transmission. They're really dealing with this conflict here. Is education and signing enough, or closing parking lots, right? Is it enough? Will people do the right thing on their own, or are more severe measures required? And resource managers are dealing with huge inundation of users and problems of overuse and inappropriate use of natural lands, also putting ecology and habitat at risk of long-term damage. But I want to return to this finding. Does does everyone have the opportunity to benefit from nature? This question has new relevance and meaning due to COVID-19 and quarantine conditions, because unfortunately inequality worsens the coronavirus. So for numerous reasons, those with lower socioeconomic status, and especially people of color, are likelier to catch the disease and also likelier to die from it. So inequality itself may be acting as a multiplier of the coronavirus's spread and deadliness. At the same time, the coronavirus worsens inequality. So quarantine restrictions might contribute to increased, adverse physical and mental health outcomes for a substantial portion of the population, particularly urban, which in turn can negatively impact how well people can fight COVID-19. So, and also for kids in underserved communities, the quarantine will exacerbate all kinds of risk factors associated with loss of education, physical activity, healthy food, quality care. So I ask, and I think many others are increasingly asking, is lack of nature and park access for some a part of the magnified stratification? Are we part of this equation? My comments here are based on my own personal experience, my research and conversations with Philadelphia residents, and findings from this excellent national study of Americans' connections with and barriers to nature. There are so many barriers for people with limited economic resources and for people of color to parks and green spaces. And so I'm just going to talk about a few of them. Some of what I have learned is based on my experience in conducting focus groups. I have been involved in the Nature PHL initiative here in Philadelphia. It is a partnership between a program manager, so the the Schuylkill Center for Environmental Education, and Children's Hospital of Philadelphia. And and it has been going on for a while now. About 5 years ago, as the program was really starting to get up and running, and we were in a planning phase, we conducted a number of focus groups with residents in communities surrounding the community clinics where CHOP, or Children's Hospital of Philadelphia, pediatricians were going to be giving nature prescriptions. And we asked folks in these focus groups, what does nature mean to them? Do they have access to nearby nature? What do they think about their neighborhood parks? And what if their pediatrician told them that they and their children should spend more time outdoors? And as you might suspect, I heard, well, time is a huge barrier. Finding time for people who are working multiple jobs. It's really difficult to work nature time into busy schedules. For kids, caregivers in so many communities, our grandparents, our friends or family may not have the resources or the mobility to get kids outside. But really the number one message that I heard here was about safety, or lack of safety. So in these spaces, so as I heard, in these focus groups, many residents won't allow their children outside at all, really, and felt even their children were not safe out in the schoolyard, supervised and surrounded by locked fence. This survey response, that's the responses to this survey item from the Nature of Americans survey, also really shows the disparities in feelings of safety around outdoor time. and outdoor recreation. Um, so feeling unsafe or vulnerable can stem from lived experience prior to or on the way to life in this country. For some, forests represent places of war, risk for trafficking, risk of assault or even death. And feeling unsafe or feeling aversion to nature can also stem from structural racism and past experiences of, for example, being enslaved and forced to work outside. Uh, Segregation is a part of founding principles, policies, and regulations for so many public spaces, that, if it's not part of formal policies, are part of the real practices that seek to exclude people of color from recreation amenities. And well, so much of the history of this is written. It's not a secret. Um, People of color may not be safe in public spaces because they're often viewed as a threat. So in New York City and other places, people of color have been disproportionately targeted for breaking social distancing rules. And Christian Cooper at Central Park this year reminded us all this year, not only the challenges of birding while Black, but also of the general dangers people of color face in public spaces. So parks and green spaces are largely managed by agencies that have mostly white staff. They bear the names and commemorate history of European Americans. Parks and green space development in segregated communities are often pieces of gentrification, which displaces most often people of color. We've heard this term green gentrification. We have even found this to be true in our vacant lot cleaning and greening research, that this treatment, the clean and green, in certain neighborhoods that feel under threat of gentrification, residents there have reported to us that they don't like seeing this, that it causes stress for them to see these vacant lots cleaned up, because it signals to them that they don't have control over their neighborhoods and will soon be pushed out. So I ask, and I think I'm in good company. There are more and more people asking questions such as how can we rebrand it as a safe space of also of belonging. So I wonder, along with education about mask wearing and social distancing, we're seeing all of these signs pop up in public spaces. What about having signs with information on alternatives to calling the police? If we see someone that we think is a threat. What if land management organizations and agencies turned inwards to revise their staff, values, and practices? So thinking about diversity and inclusion and biases that we may be furthering with our practice. Can we capitalize on nature where people are and promote a sense of belonging and safety? For example, via outdoor programs, even urban camping, right? I'm seeing more and more of these programs pop up. What does trauma-informed green space look like? Can nature be part of trauma therapy? And can we design spaces to promote belonging and safety? So spaces themselves. Can community engaged vacant land reclamation increase community ownership and safety? And I ask this actively. I'm part of the University of Michigan Youth Violence Prevention Center, where we are conducting research on this very question. So those are, I leave you with these questions, and I hope, and I'm looking for openly, collaborations on and looking to address these questions with research, and look forward to discussing with you. Um, thank you. That's all I have.
Great. Thank you so much, Michelle. Um, well, everybody, we have plenty of time for questions. So you can either type questions into the chat, or you can raise your hand with the magic Zoom blue raise your hand button. Michelle, we did have one question from an audience member wondering if you might be willing to share your slides for people who wanted to kind of go over some of the details.
Sure, happy to.
So I'll work with Dorothy, um, who's our webmaster, and we will try to figure out a way to see if we might be able to get them up onto the Campus Nature RX Network website, if that works for everybody. So stay tuned, everybody. We'll see what we can do about that. Michelle, we have a question from an audience member asking if you could elaborate a little bit more on your collaboration with CHOP. How did you get all that started, and which agencies are involved?
Oh, well, a lot of this, the leadership came from the Schuylkill Center for Environmental Education, and they initially received a grant from Independence Blue Cross to begin planning this program. And so with support from as well from the Department of Natural Resource and Conservation at the state level, as well as numerous others, they began working with pediatricians at the Children's Hospital of Philadelphia, or CHOP, pediatricians that were practicing at local clinics, and we call them our nature champions. So they were highly motivated and inspirational individuals who wanted to build a formal practice out of this that their colleagues also as well could benefit from, and begin practicing. So so I think one of the main tools that came out of this, or products, I guess, besides the nature prescriptions, was the naturephl.org, an online map of park resources. And so for every park, there is a park resource page that describes amenities available at the park, and transportation, how to get there, and all of that. So a lot of work went into building that tool, and was meant to be a primary tool that doctors could use and refer to as they counseled patients. Another element of it was the what we call the nature navigator role, where there were we hired folks with combined environmental education and community health work background or training to work with patients, after receiving a prescription, because as we know and might expect, the adherence is, there are many limitations, challenges, and barriers to that. So our nature navigators would follow up with patients. Yeah, so I hope that answers some of those questions.
Great. We have another question about somebody who would like you to, if possible, speak just a tad more about trauma-informed green space, and maybe point audience members to kind of some relevant research.
Well, I brought that term into my talk in part because I heard it and it sounded intriguing to me just a few days ago. But I don't. I wonder if we could have a discussion about this. What does that look like? And yeah, I don't have details or answers to that question. I would like to learn more about it.
Great, thanks. Well, maybe people in the audience could put something into the chat function. We have an audience member who works with PTSD sufferers and veterans, and she's interested in learning more about the survey that you performed.
Survey associated with this, the trial of the vacant lot. Maybe.
Yeah, Sandy Fortin says yes, that's the one she's talking about. Yep.
Okay. Yeah. So we asked residents about all sorts of things, perceptions of neighborhood disorder, perceptions of neighbors and family, community relationships, interpersonal relationships, mental health status. What else? I mean, we took blood pressure, and we took BMI measurements, and we asked questions that we might think that neighborhood interventions might affect in terms of our health. Um, yeah, I'm happy to, if you want to follow up, give you even more details.
Michelle, people are wondering kind of about how the Forest Service and you are moving forward in your research from here, and what steps are you looking for? Are you going towards to look at the effects of urban nature on residents?
Mm. So let's see, I'm always looking to see, can nature-based interventions reduce health and social inequalities? And so that might mean working and focusing on youth. Can engagement in and ownership over neighborhood greening initiatives, what sorts of impacts do we see there compared to, for example, other methods where engagement is not so much an element. So I'm involved in project in Baltimore, where we are there focusing on youth around neighborhood greening projects and initiatives. In New Orleans, we are conducting a trial there also of vacant lots, clean and green methods, and they're focusing on domestic violence. And we have some pre and post COVID survey responses. So we also have substance abuse focusing. So that's another area of active research. What else? So with this clean and green treatment, there's so many questions there. I mean, it's pretty basic, standard, sort of uninviting kind of treatment, right? We're not, I think, legally allowed to invite people because of ownership issues. At least with the land care program in Philadelphia, to invite people to use space. But what if on city-owned lots that were cleaned and green? What if we added a few elements of some basic, simple, and maybe low cost elements? Do we see do we see sort of health behaviors and activities surrounding or in or on that lot change or differ? What if we add an additional, more like clinical component to it, where we refer people to spend time in these spaces, perhaps with a therapist, right? Places of contemplation and of active, recovery.
So we have a question of somebody pointing out that there's a cold, dark winter coming. And given all the benefits of people in nature, how do we encourage people to continue partaking of these things, particularly in urban areas, I suppose, during winter?
Oh, it's it's tough, and it's easy for some to say, just strap on your Gore-Tex, or put on your down jacket and your boots, um, and just go outside. Even if it's cold, it's necessary to get out. Uh, in some cases, yes, we should be saying that for people that can. Maybe we need to get used to being outside when it's a little bit uncomfortable. But for others, where that gear is not necessarily available, we you know there are places for the indoor horticulture centers. Are We need to be thinking about those as essential public resources, and when it's cold outside. What else? I'm sure the audience has some good ideas as well. Anyone?
Yeah, there's quite an active chat going on in lots of different areas here. So people, if you can multitask, so your brain doesn't explode, there's listen and read at the same time. Um, we have another question wondering whether or not you've seen any issues or think about issues of climate change going along with time outdoors, particularly things like increased urban heat island effects, and whether or not this is affecting people's ability to be outdoors.
Sure. Um, I mean, so yeah, climate change affects our ability to engage with nature in so many different ways. So whether it be just the temperatures, but it can also affect habitat and ecosystems and infectious disease. So we have more higher risk of tick-borne disease, and especially in the North Atlantic now, with changing ecosystems that are more friendly to those critters. Um, but when we're talking about urban areas and the more extreme temperatures and warming temperatures, I mean, I think it just underlines the increasing importance of tree canopy in particular, across all neighborhoods. So focusing on planting and building a tree canopy in neighborhoods that don't have it. Although I will not I'll s- I'll I have to say that there are so many barriers there, that we could have an entire conference, and there are conferences on this, how to address the inequalities in tree canopy cover, that were built from these segregation policies, and now are humming residents, but there are social and economic barriers to bring trees in.
Great, thanks. We have somebody who's wanting to see if we can follow up a little bit on this topic that you brought up about clean and green programs kind of being instituted into neighborhoods by people who aren't from those neighborhoods, and therefore potentially increasing trauma of the locals. And you mentioned this potentially with respect to gentrification, but also loss of local control and these sorts of things. Are there programs where the people of the neighborhoods are participating in the design of the clean and green programs?
That is a good question. We Let's see. So, now, if I can just speak to the Philadelphia context, it is local contractors that are actually doing the clean and green work, but it's simple, and the costs are so low. I mean, relatively compared to what I think is often feasible in other places, which means the program can scale up on a huge level. So they're cleaning and greening 12,000 vacant lots per year and having a huge impact that way. But that means that contractors are going in one day, likely no advance notice, and in one day completing the work, maybe 2 days. And the community, most often is not having any say in terms of what goes there. But that is a question. If there are resources, can we involve community and or provide programs that allow community residents to adopt a lot and or give them support and resources to build their own vision and see it come to light. We have worked with Youngstown, Ohio, that they used a block grant funding to do this where community residents could apply for support and funding to reuse vacant lots, and most of those were turned into gardens or orchards. And yeah, I'm interested in following and supporting those types of programs. So with my research, do we see additional benefits from engaging and or supporting community-led efforts?
Great. Well, thank you, everybody. That's all the time we have for questions now. Um, I encourage everybody to check out the chat. People are posting all kinds of interesting URLs and studies and articles and all kinds of stuff. So the richness there is quite impressive. But I see already Stacy put up a little the magic Zoom clapping hands. And so either in person, I mean, on the video or with the Zoom, we'll just thank Michelle. Thank you, Michelle.